So we'll now continue with the second part of the program, starting with Dr. Aseem Parekh, who's head at Nair. Not specifically an external fixator man, but he heads a department. He has residents, and therefore he probably can give us some insight as to, is it a forgotten art? If it is a forgotten art, why is it a forgotten art, and how we can correct whatever lacunae we have in our training. So, all yours, Aseem.
Thank you, Mangal. Viraj, you will kindly indicate to me when we are at 12 minutes, and then again at 18. Thank you. Sudhir said in the course of his presentation, he showed a lovely slide of the external auditory apparatus. He says, beautiful placement. Placement is, if not everything, a lot. What is the master's mandate today? The mandate is to share, as given to me, to share the distillate of a number of surgeon years experience in a series conceived and conducted by the Bombay Orthopedic Society to help you connect with the master within you. Sangeet, Pradeep, Rajesh and Sudhir have dealt with a lot of facts. If we are to demonstrate something, it would be placement is everything. The Central Railway is at odds with itself. They place the auditorium next to the tracks. Placement is everything. In law, a lot of law going around, the matters are decided on points of law and matters of fact. Facts have been addressed, they will be addressed further. In medicine, specifically surgery, orthopedic surgery, what is law, what in law are laws, are principles. Both points of law and principles of the practice of medicine and surgery form a philosophy of management. You go back to what Dr. Satish Modi pointed out. Indeed, there is has not been sufficient visibility. Increasingly, we are living in an age of visibility. This is an initiative by us out of the teaching at Nair and has begun to pervade into different places. It is definitely pervaded here today. The initiative is to reorganize thoughts based on what one already knows, taking as a given that the facts are in place. And the topic I have been charged with doing justice to, hopefully, external fixation, forgotten art. I come here with a distinct advantage, having had 4 masters speak before me. And there was a bit of self-sounding. Indeed, is the art dead, or is it dying, or is it merely forgotten? For it is dead, we need to exhume it, and we need to reinstill life into it. Very difficult, possibly impossible. Strike that. If it is dying, we put it in the Sudhir, ICU? Yes, ICU. We were just speaking about the ICU there. Still very difficult. Everybody who goes into ICU doesn't necessarily come out. If it is forgotten, and we hope to come to some agreement that it is indeed forgotten, we just need to reconnect, and that is what Mindspace is all about. Where are we? Up arrow? Yes, up arrow. And yeah, can you just go back to the first, please? Yes, this is the topic we decided on. Whether it is a raw deal. Now, what is a raw deal? A raw deal is one which, not having been examined for what it is truly worth, neglected, worse, discarded. What is worse than just being neglected and discarded? Being discarded unexamined. What are the causes for not being examined? In large part, poor visibility. Spears, after a fashion. Without spears, after a fashion, it would be very difficult to imagine external fixation. Whether it's a wire, whether it's a K-wire, whether it's a olive, whether it's a Steinman pin, whether it's a Denham pin, whether it's a Shan screw, there is a spear. And what is it about spears? Take your mind back within Mindspace, take it back, and in mythology, all gateways, most gateways, are guarded with Jai Vijay with spears. To refuse entry, spear goes oblique, no entry. Once you're inside, you are trapped. When you need to leave, spears back. To stand easy, you have exit. Once again, thank you, Sudhir. I make reference to placement is everything. For spears, for wires, for pins, threaded and otherwise. And if it is forgotten, what are the usual causes of memory failure? Memory consists of 3 parts. You all know this. It is basic undergraduate psychiatry. Registration, retention, and recall. Now, if you are blessed with a memory which is wax to receive and marble to retain, a lot of your issues in life are auto-addressed. And if one is to have a difficulty of registration, it is usually a lack of attention, a lack of interest. Retention is distraction. You get more interested in other things. We use 2% of our total capacity. The smarter ones use up to 6% possibly. It's very easy to get distracted. Recall is a matter of wanting to share, wanting to communicate. All masters have good memory. They have to have good memory. It is not possible to be a master without having a good memory. involuntary, voluntary, selective. These are situations which the individual plays around with when he or she wishes to pull a fast one. I forgot. I didn't remember. I'll do it next time. You forget not because you forget because you choose to forget. For what are our needs and what are our wants? And all this has relevance to remembering what all of you in this room already know. You need a degree. 3 of my residents in the back, they need a degree. They will not otherwise be able to practice orthopedics. They want all kinds of things. They need an education in orthopedics, in external fixation. They want all kinds of things. The more senior amongst us in the room tend to confuse from time to time our needs from our wants. Needs are usually legitimate. Wants are usually frippery. History in Bombay as was. A lot of you are from the first row and certainly remember the history in Bombay pre-94-95 when the city was still Bombay. I was Dr. Thakur's junior at Cooper Hospital when we had a very dashing lecturer who imported telepathically and otherwise, I see Sudhir smiling, information about rings and rings, and a very dashing fellow. He has continued to dash all over the place. He's still dashing all over the place. And that was the story of Kurgan. And anything is possible. There were three major changes. One was the AO philosophy. There was P.K. Sethi and the Jaipur Fort. And there was the X-Fix. Moving to KEM, when Bombay was still Bombay, we started doing, and a number of us continued to do till other things became available, possibly better things, indeed better things became available, using the services of the occupational therapy department, aluminum, carpentry, Steinman pins, dental cement, and setting up fixators for what would otherwise be possibly an unsalvageable tibia fracture. Later on, the aluminum sidings gave way to crocodile clamps. Infection, big problem, hyperbaric oxygen, not available. Became a very difficult thing to do as far as providing results were concerned. At the same time, just behind the KEM, Dr. B.B. Joshi was coming out with his exposition of the entire philosophy. And Bombay became Mumbai, by which time at least 2 of the masters over here had been variously to Kurgan and both to Baltimore and picked up what was then still a rudimentary art, and they stayed with it. They stayed with it because having learned something, one needs to apply it. See, just having knowledge is not enough. Knowledge does not equate with experience. Experience is using your knowledge. They stayed with it, and it makes them, you know who they are, unique, in a unique position. It has got them into unique position for knowing what there is to know about the philosophy and practice of external fixation. So if you have 2 living people in your midst today, very accomplished people who are acknowledged as masters in the field, true masters in the field. There are no false masters. Rajesh, where is Rajesh? False masters go away before time, possibly. Anything is possible. There is no way anybody can say it is indeed a forgotten art. It is not a forgotten art. It has not lost its way. Possibly we have. Bombay became Mumbai. Back in Bombay, we had homemade, we had ready-made. Homemade is Gruhodyog, necessarily less expensive, easier to get together, easier to apply, easier to subsidize before the external fixator, like so many other things, became market driven. And we said we had the Crocodile and we had the AO tubular. I was not there. Pradeep, for your talk on external fixation of pelvic fractures, but we had recognized in text possibly as old as that papyrus. It's called Campbell's Operative Orthopedics, that a dislocated hip takes precedence over any other surgical emergency, even a penetrating abdominal trauma too. An unstable pelvic fracture bleeds with every breath. If it is stable pelvic fracture, strap it up, sling the patient. But we have no beams anymore. AO tubular, early days. Two of us, Mangal and I used to go to Ward 20 in KM on emergency days and insert AO tubular fixators, connect them, stabilize pelvis. It is possible we saved a life, maybe two, but that was the start. That was the start of on-road attention. Those days there was no EMS. What 20 km was just off the footpath. Anyway. Okay, I messed it up again. There we go. So complications will occur. Thank you. It's nice to have you here, please. Then there was, thank you. Then there was ring in Gabriel Abramovich, and we are here to discuss fixators. How many people know in this room at what age Gabriel started his formal education, primary education? You don't have to tell us, just put the hands up. Huh? One there and one there. So he was, that's one person. And we are discussing, Dr. Modi sir, we are discussing external fixation. No, we are discussing external fixation, and we are here in a master series, and half external fixator is ring, and Gabriel Abramovich was attending to sheep till age 11. Till age 11? Till age 11. Thank you, Melin. Till age 11. So, in Gujarati, there is a saying, there will be one in every language, Jagya Tanti Savar. So you wake up now at age 11 or at 10 to 12 and you get moving. See, the moment it has been shown to you or pointed out, you still choose to not go, that is your choice. And there was the AO, which we used to call the skis from the slopes, and rails and inclines, which you will be hearing about it. So it became the new game in town. So we say, Nitya Navina Dunya. See, everything, variety is the spice. So when something is new, it attracts one. And the attraction fades. So what makes for a lasting relationship? In this case, with the external fixator. Games come, games go. Trauma rules. For the first decade, based on my observation, it was all trauma. There was no deformity. There was infections, and but it was a spin-off of trauma. And then Jess came along. And then Dr. Joshi began to be heard. People started listening to him. Dr. Joshi was always heard everywhere. Trauma ruled, and everybody was preoccupied. Orthopedic surgeons know trauma. They'd like to think they understand trauma. So the application of external fixator to trauma, where nothing else is going to work. So you know it all, and if it's not going to work, external fixator. And we caught up. And then there was a time for consolidation. Fractures united, infections were controlled, move on to other things. When Gabriel Abramovich started, It was to lengthen bones. It was not to correct deformity. And of course, all the war casualties which landed up there with a neglected trauma. But go to any literature, it says lengthen bones, consolidated. And like every other currency, it was tested in all the markets. It was decided it's a long way to go. A lot of people do not choose to stay for the long haul. People dropped out. A few stayed on. They became masters. It was applied to odds, ends, curves, bends. This is the story of limb lengthening, deformity correction, trauma management. And where did we go from here? Most went home, others stayed. Some went to Kurgan, some went to Katani. Renaissance happened in the New World. Others went to Baltimore. The guy in Baltimore went to Florida. Nowadays he goes to Haiti. When you are on to a good thing, don't let go. It can only get better. Dror Paley, Mangal tells me when he was with Dror Paley, he had a packed suitcase in the office, right? So he wouldn't go home, he would go where he needed to go. Haiti, you can check out later, and Claudican, well. So what will you do, and how will you reform? How will you change? And will is in inverted commas because what will we bequeath? What will we bequeath? What are we bequeathing to our students today? What will we bequeath to the next generation of orthopedic surgeons? The value of rumination. Life not examined, possibly in retrospect, is not worth living. Think about it. What have you learned? What have you applied? What have you learned? And set it up as a cycle. Dogma is seen to be inflexible, rigid. It declines on its own. Within dogma, it is still possible to be flexible. That is the value of these programs, continuing orthopedic education in general. Do not get delirious. There is sensory overload. There is excess. This is from the book of Ecclesiastes. There is a time to sow, a time to reap, a time to kill, a time to heal. Select your timings because the same book tells you that there is a time and a purpose. There is a time and a season for every purpose under heaven. And this is something we used to say in Orthopedic Center, KM. Never say never again. It's a different way of saying different words. Is hang in there, keep doing it, something good will come of it. We have not yet seen the stern of external fixation. We have not seen its posterior. We choose to kick it in the posterior, it will be relegated to posterity without spreading information and knowledge about its applications and still unexplored possibilities. It will go the way of all theater. The fat lady will sing. That will be the end. I keep on telling my residents this. So life is simple, very simple. Life is simple, we complicate it. Straightforward fractures, we complicate them. Mind space. This is a lot of people, some people from KM here. We have a little group. This is not a title one arrogates to oneself. Okay, so this is something which I have been nominated to, and anybody on the group, come on and take right over. Thank you for your attention. Mangal. Yeah.
Thank you, Aseem.